Wish you all a happy World Hearts Day. The theme of this year is very interesting. It says, don't miss a beat. Now let us expand this theme a little further. First of all, being vigilant and proactive. So we should be aware about what are the signs or signs which we should pick up early or we should not ignore. Typical cardiac signs or symptoms are chest pain, breathlessness, palpitations, that means feeling aware of your own heartbeat, having giddiness or losing consciousness, having swelling all over the body, or unexplained new fatigue. These are the common symptoms. Not all chest pains are related to heart, but the most important or the most life-threatening is a cardiac issue. So here there are certain warning signs, like if the chest pain is a typical chest pain, that means pain which occurs on central or left side or right side of the pain, which is a feeling of heaviness over the heart, which increases on exertion or taking bath or climbing steps and releases after you take a rest. These are typical chest pain. And when the pain persists for longer duration of time, that is, it lasts for more than 3 to 5 minutes, that means it may be an indication of an ongoing heart attack where you need to visit the nearby hospitals. So it brings us to a very important concept, that is golden hour. What is golden hour? These are the initial 60 minutes when you start having chest pain. The concept is that if you visit to the nearby hospital where an emergency angiography, and if the block is there, an emergency angioplasty, that means opening up of a block can be performed in the first 60 minutes, there is almost like very minimal or none of the cardiac damage which is happening. So initial period is very, very crucial. Having said that, if the golden hour is gone, still there is a window. If somebody has chest pain, they should go to the nearby hospitals and get yourselves checked. You should also be aware what time you should approach to the emergency services or when should you dial an emergency number. When you have this kind of symptoms like sudden onset chest pain which is not resolving even after 5 to 10 minutes, or it is associated with other symptoms like breathlessness, unexplained sweating, unexplained fatigue, or a palpitation or losing of your consciousness, this is the time when you should actually visit the nearby hospital. It is better to be said at the hospital that you are not having chest pain rather than missing a heart attack and sitting at home thinking it is an acidity or just a stress level. The message is very clear. Don't miss a beat. Be more vigilant, more proactive. Take care of your heart. So if you have any of these symptoms, remember, Heart and Vascular Super Speciality Group of Hospitals is always there to take care of your heart and of our patients. Thank you very much. Jai Hind.